The causes, signs and symptoms of multiple sclerosis and what treatments are available. Multiple sclerosis can be a very difficult and debilitating disease to live with, but many treatment options are available for sufferers of the nerve damage disorder. Multiple sclerosis (MS) is a condition that can affect the brain and spinal cord and cause a wide range of potential symptoms. The lifelong condition has symptoms which include fatigue, difficulty walking, vision problems and issues with balance and coordination. People in their 20s and 30s are the most commonly diagnosed, although it can develop at any age. Women are also diagnosed more often with the condition than men. More than 8 out of every 10 people with MS are diagnosed with the relapsing remitting type, according to the NHS. This type causes an onset of symptoms followed by a period of no or less apparent symptoms. MS is caused when the body's own immune system attacks and damages the delicate nerve pathways in the brain and spinal cord. The attacks damage the myelin, which is the protective layer around nerve fibers. This process causes inflammation and temporary or lasting lesions made of scar tissue which can lead to the symptoms described by sufferers. Symptoms of the disease include fatigue, numbness or tingling in different parts of the body such as arms and legs, difficulty walking, vision problems, muscle stiffness and spasms, problems with balance and coordination, problems with thinking, learning and planning and bladder control issues. The early symptoms of MS often have many other causes and may not be linked to the disease. How is MS diagnosed? Multiple sclerosis is most often diagnosed by a neurologist. A diagnosis may come following a neurological exam and a series of tests, with blood tests being done to rule out the possibility of other diseases. Diagnostic testing may include an MRI scan. Using dyes to create contrast, a doctor can detect active and inactive lesions throughout the brain and spinal cord. An optical coherence tomography. This test involves a picture of the nerve layers in the back of your eye being taken. This can be used to look for lesions. A spinal tap or lumbar puncture. This test is used to find abnormalities in the spinal fluid and rule out infectious diseases. Specialists will look out for oligoclonal bands which can be used to diagnose MS. These bands are proteins, which indicate the presence of inflammation of the central nervous system. No cure is currently available for MS, but many treatment options exist. While everyone's symptoms and experiences are different, many experts will advise a course of steroid medicine to speed up recovery following a bout of symptoms, or a course of medicines known as disease-modifying therapies. Disease-modifying therapies may help to slow or reduce the progress of disability in people with certain forms of MS. However, specific treatments will be recommended for individual MS symptoms on a case-by-case basis. See a GP if you have any of these symptoms, or if you want to support someone who has been diagnosed with MS, visit the Multiple Sclerosis Society of Ireland's page for helpful links.